So when we talk about exercises, normally what we think about is going to the gym, or we think about going on a workout class. But sometimes that is not possible. So how can you exercise in your daily activities? Assalamu alaikum. My name is Farzana Hasham. I'm a physiotherapist working with Ibrahim Hajj. Today I'm going to talk about the importance of movement, exercises, and activity. Have you heard of the statement, movement is medicine? So what is movement? Movement is the contraction and relaxation of muscles which help your body move. It maintains your strength, flexibility, and the function of your daily tasks. So what are the benefits of movement and exercises? The first one, which is commonly known, that it improves your blood circulation, which helps you maintain your blood glucose levels, your blood pressure, and cholesterol levels. This helps in reducing your risks of cardiovascular disease like heart diseases, stroke, and diabetes. It also helps in your mental well-being because your mind and body is connected. When you exercise, it releases happy hormones such as endorphins, dopamine, and this helps in conditions such as anxiety, stress. It helps in depression, as well as it improves your sleep quality. So when we talk about exercises, normally what we think about is going to the gym, or we think about going on a workout class. But sometimes that is not possible. So how can you exercise in your daily activities? Some of the tips are, what you could do is, instead of taking the elevator, you can take the stairs. While you're going for a short distance, instead of driving, you could walk. You could also, if you have a desk job, what you could do is take breaks in between, stand up, stretch, and then you can continue with your work just to get that steps in. What you could also do at home is there's a lot of resource on YouTube for stretches. So you could take a 10-minute video and do some stretches at home. You could help with housework, and you could also take up hobbies such as gardening just to keep yourself active. You could also do some low impact sports such as pickleball, and you could take up swimming. Simple things, these all small things can really make a difference. Cumulatively, it will help your overall health and make you more active. So today's focus I want to put on is movement in relation to pain and pain management. So when we talk about pain, pain is something very personal. Everybody experiences pain in a very different way, and your mindset towards the pain plays a very important role in your healing. So if you have negative thinking or perception of pain, such as if I move, I'm going to make it worse, or movement is dangerous for me, then what happens is that your body and your mind starts believing it and makes it even worse. So developing the fear of movement will make your pain worse. Remember, when you experience pain, it's your body telling you something, and it's a way of your body protecting you and healing sometimes. So if you start believing that some pain is normal, while you're recovering, it will help you recover even faster. So let's say that you have an episode such as you hurt your back. What happens is that your body tightens the muscles around the area that you have hurt yourself in order to protect itself. And that's when the healing process starts. And this usually takes 1 to 2 days. Now, in that time, if you do not move at all, then what happens is that muscle starts becoming even more tighter, and you start losing strength and flexibility, which makes you even more in pain and more difficult to move. So how does a person move while in pain. So scientific studies show that you can even move while and exercise while you have had surgeries such as back pain, your hip pain, your knee pain. All of these require exercises. But also if you have a long duration pain, which we usually call chronic pain, exercises are important in improving your chronic pain, as well as when you have conditions such as heart conditions and lung conditions, you need exercises because this also causes pain. You also require exercises for this as well. So the key to exercising while you're in pain is to start very slowly and set small achievable goals. So what you can do is pace yourself. If you cannot do movement, then start slowly to your pain limit. So for example, if you are walking and you see that, okay, now I can't do it anymore, take a break. But don't say that, no, I'm not going to walk at all. This will help build your strength and regain your movement and the function that you have to do. And a physiotherapist can actually help you with this process. What does a physiotherapy do in regards to pain? So as a physiotherapist, what we do is we help people move better and make customized exercise programs for every patient that comes in. And our biggest strength is that we understand pain and how pain works, and we also understand the underlying conditions which bring about this pain. So these conditions that we commonly see, for example, back pain, knee pain and all, it's usually sometimes it's a bigger thing than just pain. So we, in cooperation with our other health professionals, help you treat the underlying condition. And how we do so is where we assess the condition, then we assess the goals that the patient has, and then we also assess the capacity of the patient has towards achieving their goal. Are they capable of? Are they not capable of? And then once we assess this, we make specific exercise programs for all of these patients, and how are they going to achieve, tolerate, and slowly progress the program until they are able to go back to what they used to do. For example, it could be just going back to work, or if it was a sports player, then going back to their sports, or it could simply be you doing your household activities and simple tasks such as just walking. This all can be achieved by doing exercises slowly and gradually. We as physiotherapists, we treat patients of young age to elderly people, people with limited mobility to people who play sports. And each one of these have their own individual set of goals and what they want to achieve. So by doing these exercises along with your physiotherapist helps you achieve this regularly. So in conclusion, I want to repeat what I said initially, that movement is the key and movement is medicine. So despite having your acute injury, you having your chronic pain, or just simply you want for your overall health, exercises and movement will help you just improve your health. And the key is to start slowly, stay consistent, and most importantly, listen to your body. So what exercise are you going to incorporate in your daily life today? Tell us in your comments, and thank you so much for listening.